Hi, I'm Roger Margolis, Research Director at O'Reilly, and I'm here with Fred Trotter, who has unfortunately defaulted on our wild hair contest by getting a haircut ahead of me.
Well, no, see, actually, the contest is still on. You're ahead.
Okay. I'm glad I'm winning.
Yes.
So Fred, you're always up to so many interesting things. In fact, last year, you had a relatively big announcement. I thought it'd be worth reminding people of what you did, and then we'll get into what's happened since then.
So last year, we released a very controversial data set that showed how physicians work together with the hospital systems and labs and radiology centers, how the healthcare center works. And it was a graph data set with about 50 million edges that we released that showed how healthcare worked. Now, since that time, a lot has happened. All kinds of people have integrated this into their products. It's an open data set, so you can pull it in and use it to create new value, and that has happened in spades. It's impacting the ACO market, especially. It's impacting how hospitals, arrange things. It's had a tremendous impact since we released it. Our project at that time was to overlay that data with data from states, and I wish that was going faster, but it is going. So we've released probably about half of the state data sets that we wanted to. And integrated them into the graph. Part of the thing that held us up was it's actually fairly complicated to get these things from a legal perspective. Sometimes the states will say, we'll give you the data as long as you don't resell them. Well, not only do we want to sell them, we want to resell them for nothing. So we want to give them away. Yeah, I don't even think you call it reselling when you give it away for nothing. So we wanted to give it away for nothing. And so we have been taken on as a client by the Bergman Foundation. One of their centers has taken us on because is connecting us with pro bono lawyers who want to do state-by-state Freedom of Information Act work. So that is what has taken so much time, but now we are in a much stronger position to get that done, and so that will be getting finished. But what I'd like you to ask me about is what data I've gotten since then am I releasing today.
Okay, just right before we get into it, what are you getting from the state that augments?
So what we get from the state is the node database, the nodes for our graph database were already released. We had an edge database that we released, but the node database was pre-existing. But every state has data about their physicians from their state medical boards. And we are integrating that into the to the node database. We're augmenting that. And one of the things that we've discovered is that the state database is richer than we had understood. So in some cases, it is actually a graph itself, where you see how especially where you have physicians that are signed up to monitor mid-level professionals. So you can see nurse practitioners and physician's assistants and connect them in with their physician monitoring system. So the actual state data is another graph layer. And we didn't realize it was going to be that complicated, but it's really exciting that it is because it adds a whole new dimension, at least sometimes, to our data.
That's great. So you would ask me to ask you, what is new and what might you be announcing today that more exciting news?
So, I don't know if you remember last time I announced something, but I was so freaked out.
I remember well.
I was really freaked out because I thought somebody was going to sue me. And so the way I released it at Last Trotter X is I gave everybody a USB stick, so everyone had the data, and then I announced the password so that everybody could unlock it, and there would be no way to pull it back. So I could do a massive release instantly. Right?
A little Danger Mouse-ish, if you know what Danger Mouse did with the Gray album. Are you familiar with that?
I know.
So Danger Mouse, his name is Brian something, took the Beatles' White Album and Jay-Z's Black Album, jammed them together.
Okay.
Now, it's totally illegal, of course, to jam those things together. And what he did is he made a mass announcement of his website for downloads for a very short period of time, and there wasn't much that could be done. So, whether you knew it or not, you were...
Yes, well, I was using the same methods. I'd like to think what I was doing was not illegal, and I hope everyone else thinks so too. This time, right, we've released a tremendous amount of data, and we are not the only people who have. So ProPublica was able to acquire, under a FOIA request, a tremendous data set about the way physicians prescribe. And they created a tool that's still available on their website where they've got all of that data mashed up. So you can look up how your doctor prescribes medications. Tremendous data set. So the wonderful thing about FOIA is that you can ask for a FOIA of a FOIA, so we did that. We acquired that data set. And we are now crowdfunding again the integration of that prescribing data into our graph. Now, what that lets you do is you can see a network of physicians and how they work together, and you can analyze how they prescribe as a network, right? So it's a whole nother layer on the graph. This data set has about 30 million rows, edges, right? Between physicians and prescriptions, and it is not directed, but it's a weighted graph, so I can tell in general how much they're prescribing of a particular medication. And then we overlay that with our previous graph, and you have an exponential increase. So there's 50 million edges in our original data set, 30 million in this one. It is not 2x, it's x squared. The complexity of the graph that we are offering is tremendous now. So what's fun is, if you are at StrataRx, you can follow the @DocGraph Twitter handle, take a picture of anything or anybody around here that proves that you were here, and we will direct message you after you tweet that. You have to tweet it, but then after you tweet that proof, we will direct message you a link to the data. Now we don't have to be quite so worried. ProPublica wasn't sued, we weren't sued, everybody can relax. But now we're going to have a little bit of fun with it. So we're distributing this data set, this huge data set. Again, it's hard to overemphasize how important this is. If you wanted to buy this data set a week ago and you were going to go shop on the proprietary market, you'd be talking 7, possibly 8 figures to get this data, right? And now, surprise, a gift for all StrataRx attendees, in the crowdfunding you can get it for $100. That's a significant reduction in zeros. And we're doing it in a way that you also get the previous graph. So again, if you are a data scientist and you're interested in graphs, you're interested in the way the healthcare system works, this is an extremely valuable data set, and I'm really pumped. Now what's interesting is that while I get the data from the government for free, it was not free for PubliCA to get. They put a substantial amount of effort into getting that data set, and we're releasing it ahead of them. I think they're planning on releasing it later. So we're going to donate 1/3 of everything all of our data sales, 1/3 of that is going to go to ProPublica. We're going to donate that to a nonprofit to support their work. This is really important that organizations like ProPublica continue to do what they're doing. I'll also give a plug for the fact that they're doing tremendous work on the NSA Snowden stuff. I don't know if you've watched their articles, but they've done some very serious analysis work. They are true data journalists, so it's really important that we not kind of undercut that by not helping them to get forward. So I don't know how much, again, the last time I was talking, I don't care how much money I'm going to make. If I make a little money, great. If I make a lot of money, I'll do a lot more. Same basic principle here, but this time, if I make a little money, I'm going to share a little money with ProPublica. If I make a lot of money, I'm going to share a lot of money with ProPublica. So we're obviously really excited about it.
Well, it sounds fascinating, interesting, and I'll bet paranoid doctors have little images of Fred popping up.
I have already had some conversations, even at this conference, that were somewhat uncomfortable.
I'll bet. But, the way that we're going to make healthcare not just more transparent for transparency's sake, but to extract more data that is usable by more people is by understanding what's going on with all sorts of data.
That's right. And if you're a physician, and I want to speak to the camera here, if you're a physician thinking of shooting me or something because your prescribing patterns are out, please consider that it was ProPublica that released it as an individual data set. The difference here is that I'm allowing aggregate analysis. So you could always go to ProPublica's website and see. That happened months ago, right? It was big news when it happened. But I'm not the one who did that. ProPublica really deserves this. What I'm doing is integrating that in. So it's analyzing a network. That's going to be the controversial. I think I am going to make the hospital CEOs really uncomfortable in some cases because they say, oh, we as a hospital overprescribe antibiotics, or we as a hospital overprescribe. This is the first time you'll be able to see those patterns in the open.
Right. Well, one thing too is just as I come from the data world, is that this is the kind of data set that if you're an aspiring data scientist, it just might be fun to work with. Graphs are something that we think of as a, not unknown, but not as well established, a place for people to work on. And yet they're exceedingly important as social networks and so forth become more a part of our lives. I think it's a great data set to just play with.
It absolutely is. We've already had a bunch of people make reputations on the data set. LinkedIn has a bigger data set, Twitter, Facebook, everybody's got bigger graphs than we do. But this is the largest graph that you can get in the open that uses real names. And now that you're talking about real names of people and the real names of the medications they use, from a graph analysis perspective, this is probably the largest data set that an individual curious data scientist is going to be able to easily acquire and analyze, which is so much potential.
Right, and I mean, just as a data scientist, if you're trying to work on something, you might be able to actually do something useful as well as playing. So I think that also is an advantage. So anything else going on with the data, the Fred and data world?
Well, yes.
Tell me more.
So we swapped haircuts, and so that happened last year, and we did this amazing prescribing data set. The next project we have is a food database. Now, there is a tremendous amount of stuff available as open source food data sets. You can get information from the FDA, you can get information from other countries have the equivalent of the FDA. There's all kinds of data out there. The problem is that in general, the data tends to lend itself to a particular use case. So FDA data kind of lends itself to public health analysis. Now, when you go scan a UPC on the back of the food that you buy at the grocery store, there are data sets out there that will allow you to link to that with the ingredient information on the back and the nutrition information, and we would like to be able to do that. We'd like to be able to do the public health use case. But most importantly, we want to start addressing with that the allergy use case. Now, if you're allergic to something, you're not allergic to an ingredient, you're allergic to a protein structure within an ingredient. So one of the problems with peanuts, for instance, is that it's not one protein structure, it's several that you have multiple allergic reactions to. So one of the reasons why peanut allergies are so famously bad is you're really not talking about one reaction, you're talking about multiple reactions that your body's happening at the same time to different protein structures. So what we really would like to be able to do is have a food database that is open source, inexpensive for everyone to use, of extraordinarily high quality, that allows you to go into a grocery store, scan the back of a bag of chips with your phone, and the app that's doing that has access to a database that allows it to map what it sees all the way back to protein structures, so that you can do extraordinarily complex things. So the reason we did this is that Cincinnati Children's approached us, and Cincinnati Children's is one of these centers of excellence for a children's hospital.
I'm very familiar with that.
The patients that they get are not easy patients. So very frequently, the profile of a patient that goes to a center like this is they're allergic to peanuts and they have irritable bowel syndrome, right? And what happens is that when you have these kind of interacting food diseases, it becomes a rare disease in combination, right? So you have two pamphlets that these parents will get for how to manage their kids. This says you can eat these things. This pamphlet says you can eat these other things. And in fact, there's nothing in the middle, right? So if you have a food-related disease that is not typical, the data required in order to make diet decisions is extraordinarily complicated. And Cincinnati came to us, they explained this problem, got lectures about protein structures, which I didn't know last year, and what they asked us was, can you find a way to develop a database that will allow us to write lots of little apps that would solve problems for what end up being very small patient communities, 30 people, 40 people, maybe 200 or 300 people. In order to do that, we have to get the cost of the data extraordinarily low, and that's what we do now. We create data sets. This is the first time we'll be doing it from scratch, but we create new data sets, and then we release them as open source. Now what's interesting is that in this case we're crowdfunding this, so that we have the funding in order to do the development, but it's a dual crowdfund. You can pay us in dollars or you can pay us in scans. So you can go to the grocery store and scan 1,000 items, and if you do that, I'm going to treat you in the project the same way I treat the people who gave me $1,000, because it's almost as valuable to me, right? So helping me to crowdsource this is extraordinarily valuable. So we've written already a version of an app to do the scanning, and it works. We want to finish the app, develop the infrastructure, and we want our community to come together to help us to make this extraordinarily high-quality database. So it's really exciting, and I'm really pumped.
It sounds great, and it also reminds me of the parade in Portlandia, the comedy TV show of people's allergies.
Really?
Yes.
I'll have to go watch it.
Yes, you should watch it. They act out how their allergies might affect them. It's really very
Okay.
funny.
Okay.
So you're always up to so much interesting stuff. I can't wait till we do the interview next year and hear that there's a few more things.
Well, if we do as much more this year, next year, as we did this year compared to last year, I'll be telling you that I'm reading minds and things. I mean, this has really been a pretty big year. Although next year I am planning to beat you in the hair contest.
Excellent. I am planning on getting a cut.
Okay, good.
Thanks a lot, Fred.
All right.
I'd be remiss if I didn't mention that Fred Trotter wrote one of my favorite O'Reilly books. He and David Ullman wrote Hacking Healthcare. What I like about it is it does a really even-keeled look at health IT, and they're really good at separating fact from their opinion and recommendations. So if you're interested in the topic of how health and IT interrelate, it's a great book.